Hello.
Hello.
I show up as a participant, not as a speaker.
Dharmendra, correct?
Hello, ma'am. You're a co-host now.
Okay, thanks. Thanks. Okay.
Good afternoon, all, and welcome to another session of Sweet India COVID-19 Academy. As you know, it's a week-long celebration of our midwives and nurses, and today is the International Day for Midwives and Nurses, and we are approaching tomorrow the second last session of the on YouTube series. I'm Praveen. I will be your host for today's session. Today's session is on from commitment to action, midwifery as a means to both combat COVID-19 and achieve universal health care. We have eminent speakers here. with us today. And our moderators for the session are Dr. Priya Karna and Dr. Ram Chahar from WHO India. Dr. Priya Karna is the Technical Officer for Reproductive Health at WHO Country Office for India. A medical doctor from Nepal, she is trained in reproductive health policy at Johns Hopkins University, Baltimore. At WHO India, she currently leads the SRHR initiative, Samarth Sustainable Accelerate Mainstream Access to Reproductive Health through Health Systems, one of WHO's global flagship initiatives on ending preventable maternal mortality with a focus on
Praveen.
safe abortions.
Praveen, this is
Yes,
Astha. Sorry to interrupt you. Can you be a little bit louder?
Yes, Asta.
Thanks a lot.
Oh, I'm sorry, Asta. Yeah, thank you. Am I audible now?
Yeah, I think it's a little bit better.
Am I audible now, Asta?
Yes.
Okay, great.
Just trying
Small problem with my mic. Yeah, sure. Thank you. Thank you. Dr. Priya Karna is a member of the WHO India emergency team for COVID-19 preparedness and response. And next moderator, Dr. Ram Chahar, is a National Professional Officer for Maternal and Reproductive Health at WHO Country Office for India. As a public health professional, he has a rich experience in planning, implementation, and evaluation of maternal health program in the country. He has extensive experience of working with frontline health workers and is a strong advocate for equal access to quality care to reduce preventable maternal deaths. He has been actively contributing at the national level on different policy initiatives for maternal and newborn health. Welcome, Dr. Priya Karna and Dr. Ram Chahar. Welcome, dear panelists. We have a wide range of panelists from Minister of Health Affairs, Jamia Hamdard, White Ribbon Alliance, Bill and Melinda Gates Foundation, Fernandez Foundation, and WHO India as well. So once again, welcome you all, and over to you, Dr. Ram.
Thank you, Praveen, and thank you, Asta, for hosting today's session. Praveen has beautifully summarized that today's session is all about the use of the nurses and the midwife as both a means for the combating the current COVID outbreak and also for achieving the universal health coverage in the country. Nurses and midwife, as we all know, play a very crucial role for the health promotion, disease prevention, treatment, and care part. And as per estimations from the World Health Organization, close to 1/2 of the total active health workforce around the world is constituted by nurses and midwives. For today's session, we have an eminent group of speakers from the country who have been instrumental in taking forward the midwifery initiative. First and foremost, I would like to welcome Dr. Dinesh Baswal. Dr. Baswal, he is advisor for the maternal health at the Ministry of Health and Family Planning. Dr. Baswal did his MBBS from Maulana Azad Medical College, New Delhi in 1983 and has completed his MBA from Faculty of Management Studies, New Delhi in 1995. Currently, he is providing technical support to the ministry in national policy decisions on maternal programs, and he has been one of the most important pillars for taking forward the midwifery initiative in the country. He is a member of the various national expert groups for maternal health and training initiatives and the programs. To his credit, he has published in the various national guidelines related to maternal health, and he is also supervising and coordinating with APEX technical support agencies for maternal health in the Government of India as part of the Ministry of Health and Family Welfare. Apart from Dr. Baswal, we also have Dr. Manju Chugani. Dr. Manju Chugani, she is the principal at the Faculty of Nursing at the Jamia Hamdard School of Nursing Sciences and Allied Health, New Delhi. She started her journey as a midwife around 28 years ago, and she serves as the board member for the Midwifery Alliance of Asia, bringing insights on the implementation, communication, and research related to the maternal and child health. And she is a very strong supporter for providing holistic midwifery care. She has contributed the development of a number of national guidelines and handbooks in collaboration with the Ministry of Health and Family Welfare. And she is also an executive member of the White Ribbon Alliance of India and board member of IPAS. She has 49 publications, 6 chapters, 5 books, 15 guidelines under her umbrella. Dr. Manju, we are privileged to have you today with us for the session. Dr. Leela Varke, she is an accomplished public health specialist, currently working as senior advisor for reproductive, maternal, newborn, and child health at Center for Catalyzing Change. She is also on White Ribbon Alliance's India's team for Joint Action for Nurse Practitioners of Midwifery and Midwifery Program. Dr. Leela has Doctor of Science degree focused in maternal and child health from Johns Hopkins Bloomberg School of Public Health and has more than 10 years of reproductive health research experience with Population Council, New Delhi. She is also a member of the high-level expert group on universal health coverage in 2010-11. Dr. Leela also holds the position of COO of TNAI and State Secretary of SOMI Delhi chapter. Dr. Leela, welcome for today's session. As a next panelist, we will have Ms. Medha Gandhi with us. Ms. Medha, she is the country lead for family planning and maternal, newborn, and child health policy at Bill and Melinda Gates Foundation. Medha oversees the foundation's policy initiatives on family planning as well as on maternal, newborn, and child health. She leads the work streams for creating enabling environment for women and girls for quality MNCH and family planning services in the country. Medha has been working on SRHR issues for the past 19 years. Prior to joining the foundation, Medha was Director Policy at IPAS Development Foundation. For over 6 years at IPAS, she led the policy initiative and managed the policy paradigm and partner engagement for increasing access to comprehensive abortion care in the country. We also have Ms. Indy Kaur from Fernandes Foundation with us. Ms. Indy is the Director of Midwifery at Fernandes Hospital, Hyderabad. She has successfully trained 30 nurses in a public-private partnership with the Government of Telangana and UNICEF. This has contributed to the Government of India's commitment to the need for professional midwifery in India as a separate profession. She has been acknowledged in the strengthening of midwifery guidelines, and Fernandes Foundation is one of the first training sites in the country where the training of the nurse midwifery educators in India has been undertaken in collaboration with the University of East Lancashire, Government of India, and World Health Organization, Country Office India. Her previous role was as a consultant midwife for public health with Barts Health NHS Trust, and she is also a member of the East London Saving Lives program. We will also have some discussions and very pertinent, consultation with very young midwife with us, Ms. Pragati Sharma. Ms. Pragati is a national consultant on the midwifery with the WHO Country Office India. She is a nurse midwife who is passionate about quality, equitable, and respectful care for maternal and reproductive health. She is a public health graduate and has a range of experience in public health in SRMNCAH area, both in India and abroad. She is also a graduate in public policy from the University of Oxford, and her experience includes working in policy and planning, program implementation and evaluation, research, and capacity building. Her professional association has been with UNICEF, Jaipigo India, WHO headquarters, etc. At present, she is working as a national consultant for midwifery with WHO India. Dear panelists, I welcome you all once again for today's sessions. And to formally start the discussions today, I welcome Dr. Dinesh Baswal once again. Sir, we would like to hear from you about the commitment and the focus which the Government of India has provided to the midwifery program in the country. Sir, you will have around 5 to 7 minutes for the discussions, and I welcome all the participants and also all those who are currently online for today's session to kindly provide us the inputs as well as, what all the pertinent questions are there that you would like to have with the participants. Please type in the QA box and we will have the questions at the end of all the panelists' discussion. Sir, over to you for your inputs.
Dr.
So we are not able
Baswal,
to.
sir, we would like to hear you. Asta and Praveen, could you check if sir is on the call?
Yeah, sir. Yes, Dr. Priya, he's on the call, but I think he's having some trouble with the audio. Dr. Dinesh, we can't hear you.
Just for the benefit of everybody, Dr. Ram gave a very good introduction of Dr. Baswal, but I'd also like to just share as he comes on board trying to fix his technological challenges at the moment, just to share with the audience that Sir has really led from the front in operationalizing Government of India's commitment towards this new cadre. In many ways, it's not a new cadre, but it also lacks the recognition that it deserves. And for that, we find a very big champion in Dr. Baswal. Once again, I'd like to just check. Sir, are you able to join us now? I think I can see him.
Hi, Dr. Dinesh Baswal was having some internet issue. He's logging in again, and let's wait for him. Or would you like to continue?
Maybe at this point of time, let's start with our second speaker, Dr. Manju Chugani. Dr. Ram has already explained that she is a principal faculty in nursing Jamia Hamdard. Dr. Ram, would you like to take over and introduce the session?
Yeah, till the time Dr. Baswal is for a moment, Priya, can you take it up? I am getting a call from Dr. Baswal's office.
I'd like to now invite Dr. Manju Chugani, who's faculty and dean for the Nursing Institute at Jamia Hamdard. She's spent decades in, stressing on the role of advocacy and leadership in sustaining commitments towards a new health cadre. And I'd like to now invite her to share her views and present on this topic. Dr. Manju.
Thank you so much, Priya, for introducing me. I have small correction. I'm not a principal at present. I'm Dean, School of Nursing Sciences, Allied Health. So
congratulations, ma'am. Congratulations and welcome.
Thank you so much. Can I have my slides PPT on?
Sharing now, Dr.
Yeah.
So is it visible?
Yes. So can I change this from my system?
Dr. Manju, you can tell me to go forward. I can press the next one.
Yeah. We can
just go next.
To the next slide.
Yeah, right. Yeah.
Yeah, next, please. Yeah. So when yesterday I was asked to speak on this, the advocacy, the role of advocacy and leadership, I started thinking that it's a long journey and the time given is 5 to 7 minutes. So I tried to put it in a form of photographs, pictures, pictorial kind of thing, so that it's a passionate journey actually, and would not finish even in hours, but I'm trying to finish it. I want first slide first, before this, the previous one. So 20 years ago when we started, I used to introduce myself as midwife. For last 20-25 years I have been doing that, and sometimes I heard that what this cadre is, what is this? So, but I have been doing it persistently till today. Next one, please. Next. Yeah, but I'm happy today that we have with us all partners together, and now people are well aware of the word midwife. And I would say that eventually in 2005, India reached to an agreement about competencies needed to provide skilled care in and around childbirth, and professional midwife can do it. Next, please. So that was the agreement. And next slide, please. So no, it has skipped, or no, go back.
Go back.
Yeah, that's my third slide.
Praveen, the
My third
previous.
slide.
Right, this one?
No.
The previous one.
Yeah.
Okay, this was the last slide. You want
Okay.
to go next, right? This one.
Yeah. After this is the whole story. Yeah. The major milestones for midwifery when I started my journey with this advocacy. I want that description. When I started my journey on this road, it was the year 1999-2000 when we started with the midwifery association work. The previous one, please, with the milestones. Okay.
Yeah.
So in the year 2000, side by side, there were global, and in the Asian region, also a lot of activities were taking place. We were doing our own advocacy and started this journey. Side by side, other international NGOs like UNFPA, ICM, WHO, UNICEF also were working towards this. In year 2000, global launch skilled care or skilled attendance was taken place. Then in 2004, Islamabad Consensus on Skilled Birth Attendant. 2005, in India, joint WHO, CRO and UNFPA Regional Workshop on Accreditation of SBAs was held. Then 2005 was a very eventful year. 2005 World Health Report, Every Woman, Every Child Counts, was launched in India. And 2006, UNFPA Global Launch Investing in Midwives and Others with Midwifery was launched. Then 2010, UNFPA APRO Regional Workshop on Midwifery took place in Bangkok, and I was part of it. And 2011, SOMI first report was released, and I was consulting for this with UNFPA. Then 2013, WHO CRO workshop on strengthening professional midwifery by midwives in Bangkok held. And after that, there was again 2014 SOMI report, and it continued every year. Next one. Next slide. Priya, can I have next one? Yeah. So
yeah,
this,
I'm on the next slide actually.
Yeah. This is midwifery. Midwifery matters is the it is a newsletter which I picked up in 2005 from Brisbane conference, ICM conference. And I have preserved it till today because the title Midwifery Matters is so catchy and it has such a deep impact on my mind that yes, in India too, one day we'll have that midwifery matters to everyone, whether it is a policy making decisions or it is practice, service, teaching, research, everywhere. I thought one day midwifery matters will come to India as well. And today I feel very happy to share this slide actually. I took out this newsletter and I thought I'll show it to everyone that that was the catchy title which was there in my mind, and it is still there, that midwifery matters. And one day I'm sure that it will matter more and more in Indian population and healthcare providers. Next one, please. Next.
To the next slide.
Yeah.
Yeah.
Yeah. In 2015, actually, it really started getting momentum with in India as well as in Asian region. And there were series of meetings to discuss this issue after 2015. Next one.
Praveen, next, please.
I think we have to go a little faster with the slides.
Yeah.
Yeah. In 1999-2000, we started working towards establishment of Society of Midwives. I would acknowledge here that under the guidance of Dr. M. Prakashamma, whose idea it was to start this, this society. And with a small group of people, like we started with the 10 people actually. 10 people were the members, and then we had target to make it as 100. And then we were working towards this strengthening of the society, because we heard in every country, the associations have played a major role in strengthening and doing advocacy and leadership in the field of midwifery. Next one, please.
Next. Next one, Praveen.
After starting of this society, we started doing small activities to contribute towards safe motherhood and for reducing the maternal and child health in India. And this was the first activity. After that, we did it with White Ribbon Alliance in collaboration with White Ribbon Alliance, a free health checkup camp for mothers and newborns. And we distributed free medicines and baby wrapping sheets. And it was a huge success. Very big health camp was organized. And it was in Molarband village in one of the urban rural area. Next one, please.
Next, please.
Praveen, can you hear me? Yeah.
Yeah. The slight delay, ma'am.
Yeah. We started the celebrations also, because every time in India, when we start something, we land up into only academics. So I read in magazines and newsletters that on 5th May, all midwives have celebrations, dance party, and all those kind of things as well in the evening. So we started celebrating this day with party also, to show that this is the day to celebrate their hard work. Next one, please. Yeah, this was very, very important and landmark event when we started training the SBAs. And in this, the SEDPA, and it was a project of White Ribbon Alliance. And we did training in 3 states, that is Uttarakhand, then Gujarat and Haryana. And during this project, I was SBA trainer, and we did this training program as a pilot project, and it was a successful program. And after that, the trainings and the master trainers and skill part was given more importance than the theoretical part. This was the landmark training programs and the project. And this is the picture from 2005 when I was master trainer for SBA training. This is Gujarat. And the girl sitting here is Agira, who gave me this picture yesterday. I could collect some of the old pictures from different places. She is still in touch after 2005 also. Next one, please. Yeah. Then after training, there was a system of monitoring visits to all health facilities. And these health facilities, when we were visiting in district health, hospital, then CSCs, PSCs, and I cannot forget those monitoring visits, because I was accompanied by Dr. Manchanda, who was very strict doctor. And when I was looking at the documents of the health workers which they had maintained, I said, sir, wonderfully made photographs. I have found very nicely, neatly done photographs. He said, then throw them in dustbin. I was surprised what he's saying. I was very happy because I was very young that time, and I thought, oh, they are doing wonderful jobs, so neatly done. But he said, throw them in dustbin because they have been done post facto. After that, so they should not be a straight line, and the importance of photograph is that it should be done simultaneously, because we have to identify prolonged and obstructed labor cases. So those were the experiences of monitoring visits I had, and I think it is an important component. Monitoring visits, minutely done, is an important component of any training program or any advocacy or wherever you want to do improve the midwifery skills. Next one, please. Yeah. In 2005, another important event was ministry delegation, along with the council people, along with the NGOs, representatives from NGOs, and I was also part of this delegation. Interinstitutional collaboration between institutions in India and Sweden for improving midwifery and emergency obstetric care services in India. And under this, there were CMTs were established, training programs were going on to train the master trainers, tutors were trained as master trainers. And after that, the next one, after that, the component of the concept of midwifery was accepted by our policy makers. By our policy makers, we started working on different guidelines, programs, and in 2014 October, first National Skills Lab was inaugurated in Jamia Hamdard in collaboration with Ministry of Health and Liverpool School of Tropical Medicine. And 5 skills labs are there now, but this was the first one to get inaugurated and have regular training programs from different states of the country. Medical doctors are coming, ANMs are coming, staff nurses are coming, nursing officers, are coming for this training program in this lab regularly. Next one, please. Then this was actually the landmark event again. In 2016, there was a national consultation on rising rates of cesarean section. And I was the single midwife present in the boardroom, the meeting room, and it came out as one of the factor or one of the recommendations, I would say, that if we have midwives who will promote the normal birth, normal deliveries, then the rate of cesarean section can come down. One of the important recommendation of that, and the beautifully written report has narrated very well. The picture is shown in this slide. So this was the place where all stakeholders, all international NGOs, government representatives, you can see Dr. Dinesh Baswal sitting there. Next one, please. Next slide. After that, in 2018, our national midwifery guidelines were launched. And then 6th November 2019, the first batch. Indy will, I'm sure, will speak on this. Then the midwifery-led care unit, concept of midwifery-led care unit was held in Gujarat, and I was part of that national consultation. Next, please. Next. So I have been into this I have been actively involved in the midwifery leadership in different platforms, because it is very important in shaping the policies for achievement of sustainable development goals. And this has happened in New Delhi in October 2019. Next, please. I thought from the beginning itself, when we are starting with the education component and practice component of midwifery, research is an important area which should start from the beginning itself. So I had invited, and we had a collaborative project with the Dundee University, and they were here. And along with the help of ministry, again, Dr. Baswal was one of the important member in guiding and arranging this meeting. And he also participated in this meeting. Next one. In this meeting, we decided the 3 areas of research work which we should start with: the training itself. And we are still working with the Dundee University people. And there is a Quality Maternal and Newborn Care Research Alliance, which is also working on the similar areas on quality of midwifery care, on the research. And this is the team which was there to discuss the various aspects of research in midwifery. Next one. Next. It is very important to collaborate with obstetricians, gynecologists, and pediatricians and co-workers as well. So I have been doing this since the beginning itself, working with AOGD, Association of Obstetricians and Gynecologists of Delhi, UNICEF, UNFPA, IDF, White Ribbon Alliance, for upliftment of midwifery, and have been doing various activities with them. Next one, please. Time to time, different activities we are participating in and representing midwife as a strong voice in whether it is a abortion care or it is a maternal and child health care during labor and antenatal period or postnatal. Next one, please. Various agencies like UNFPA Bangladesh, we have been taking, they are coming to the skills lab for exposure of the skills lab here and how we are doing. This was the Bangladesh delegation. Next one, please. We were invited by Care India in Bihar to plan how can we strengthen their nursing and midwifery. And we have here with us also the Dilip Kumar sir, Manju Vatsa madam, all dignitaries were there to help them to strengthen their nursing and midwifery component. Next, please. Next. Yeah, I was invited to Harvard to speak on midwifery and the rates of cesarean section. Next. This is an important slide where I wanted to say that actions which are required, we are on a right track, but we need to further strengthen this. And for this, we need regulation, we need education, we need professional identity and associations, we need to have systems in our health system, planning in health systems. So if we start with the regulation, political will and support to midwifery, which we have at present, and in that separate section in Council, Indian Nursing Council of Midwives, then right to enter education program, like entry standards, right to practice registration, scope of practice, standards of education, standards of practice, maintaining right to practice, and disciplinary and removal of right to practice if there is problems. Disciplinary action should be taken if it is not on the right track. Then professional identity and association is another important component. It needs to be empowered and should have this respect from co-workers, obstetricians, and other team members. Community recognition and partnership is another important component, and have a voice, advocacy with the other professional organizations and also with the community people, that yes, who is a midwife, what all she can do, what is the philosophy of midwifery. Then in education, having a very robust plan and education system to develop competencies among the students and competent faculty also. Then in health systems, formed up career ladder is one of the important thing in this, and deployment plan. Then supportive supervision, retention and functionality, supplies, equipments, means they should get a supportive environment. Whatever is required, they should be able to get that, and the robust referral system. Next one, please. So sustainable and sustained and tireless efforts to strengthen midwife across India. This is the road to success. And I have been still conducting deliveries. This was the, I think, last year delivery conducted by me, 2.7 kg baby weight, and it was a normal delivery in Safdarjung Hospital. Next one. So I want to acknowledge that the journey which I have presented, everyone has played a very, very important role in this journey, starting from the Jamia Hamdard and Government of India, Answers, SOMI, WHO, UNICEF, UNFPA, IDF, White Ribbon Alliance, JAPIGO, ICM, TNAI, INC. Next one, please. So next is the last slide. So I started alone. That is, मैं अकेला ही चला था, जानिबे मंजिल मगर लोग साथ आते गए और कारवां बनता गया. I wanted to thank Renu, who helped me to put in these slides in order. Thank you so much for patience listening. Thank you.
Thank you so much, ma'am. What an incredible journey, I must say. More than 20 years now, 2 decades of fighting the fire, and here we are today. So thank you so much for all of your efforts for starting this Karma, let's say. And now I'll hand over to another pioneer of our journey. You know, you mentioned in one of your slides also, Dr. Baswal was sitting there on that dais.
Everywhere, every time.
He is a true champion. And now I think that he's online. Dr. Ram, would you like to take over and invite him, please?
Yeah, sir, Dr. Baswal, we are very happy to have you again. Are you able to hear us, sir?
Yeah, I am hearing. Now you are able to hear me?
Yes, sir, loud and clear, sir. So,
Okay.
Yes, sir.
So, you know, good evening, everyone. And, you know, let me take you to the journey, how we actually, you know, operationalize midwifery in India. So, you know, the GI has been making a significant progress. Majority of you know that we have been able to decline faster than the global decline. You know, the global decline has been 45%. India's decline of maternal mortality has been 78% decline. But still, there are a lot of efforts and you know, we need a significant accelerated efforts are required to achieve these sustainable development goals for maternal and newborn health. In these direction, we have taken a number of initiatives, and you know, one of this is midwifery. The skilled and motivated nurse midwifery play a key role in achieving positive health outcomes for mother and children. According to the Lancet series, you know, on midwifery, safe and effective midwifery care, which includes family planning, can avert 83% of maternal deaths, stillbirths, and newborn deaths. And of course, 24% of preterm births can be prevented through a model of midwifery-led continuity of care. So what we have done in India is that we are opting for a collaborative care. So it's not like that, you know, with the collaborative care is that the low risk, the cases are actually, you know, classified into low risk cases and high risk cases. Low risk cases are being managed by midwife, and high risk cases are being seen by the obstetrician. So, you know, in December 2018, India taken a historic and landmark policy decision to roll out midwifery services in the country through establishing midwifery-led care units in the labor room of high case load facilities by creating a cadre of nurse practitioner midwifery. Now, let me take you to the progress so far. What we have done, we have released the release of guidelines on midwifery services in India during the Partners Forum in December 2018. That paved the way for rollout of the midwifery services in the country. GOI is basically, you know, we developed a National Midwifery Task Force formulated in January 2019. There was a technical support which is provided at the national level so that, you know, we have a team of people who actually, you know, we sent a guidance note on planning for midwifery initiative and selection of midwifery educator, which was prepared and issued to the state. Almost all the states have in this year's PIP, almost all states have been asked, and they have all budgeted for the rollout of the midwifery initiative. A series of meetings has been conducted with Indian Nursing Council and various development partners to accelerate the initiative and take the midwifery initiative to the next level. Midwifery educator NPM curriculum has been finalized in collaboration with INC and of course the National Midwifery Task Force. Also, various experiences which we had, and we developed a national roadmap for midwifery initiative have been developed, and a national consultation on roadmap for midwifery was held in August 2019. So we started the first batch of midwifery educator, which was started in 6 November 2019. And 30 candidates from 5 states, 6 each from these states were selected. And of course, we had international and national educators engaged for midwifery educator training. So let me tell you that, how we have planned. We have planned that, for a training, we are training first the midwifery educators, 6th batch of that, which goes to the state. They start the midwifery, and this is done in the State Midwifery Training Institute. We have 6 centers here in India, throughout India, where we will be training the national midwifery educators, and they will go into the states and do the training. Then considering actually, the need for quality training, for developing a strong midwifery cadre in India, so scope and standard of practice for the nurse practitioner midwifery in association with Indian Nursing Council has been developed. There was a national consultation on midwifery-led care unit held at Vadodara, Gujarat in November. And GI is in process of developing the operational guideline for midwifery-led care unit. Along with that, we also have a group which has also worked on quality assurance and also monitoring and evaluation. So basically now, we are in the midst of developing the various other centers, National Midwifery Training Institute, where these trainings will be conducted. We have also developed a portal, which is in the process of developing, which will be a one-stop solution for midwifery, where we are putting every material on that, and people can log on to that and see what we have developed so far. So it is in the developing stage. And because of the COVID-19 pandemic, the ongoing midwifery training was interrupted, and so the training will resume as the COVID gets basically cases come down, and so that and we'll take a decision on that when to start again the training, and so that these midwifery national midwifery educators don't lose. And we don't start from scratch. So they are being engaged in giving, and they have been given, assignments like that, and various mentors, national midwifery educator are in touch with them. So this is in short, which I wanted to share. So over to Ram for further.
Thank you so much, sir, for guiding the audience and all the participants with the journey so far, and how the Ministry of Health has been one of the most sounding pillars for the launch of the midwifery program in the country. Sir, it is also very heartening to see all the policy level decisions which have been taken under your leadership at the highest level. Sir, this has led to a situation where the first batch of the midwives is currently being trained in the country as per international curriculum, which has been developed in-house by our partners. So we have seen a lot of policy commitment from the highest level. Now I would like to invite Dr. Leela for the comments. We have seen that the ministry is invested in establishing the midwifery program in the country, and we consider it to be a game changer for improving the quality and improving the access to the quality care. How the work through the White Ribbon Alliance is feeding into the midwifery initiative in the country, and how the community at large will be able to see the utility, or create the demand for the utilization of the midwifery-led services. That will be something that our participants as well as we all will be very interesting to hear based on your work and your ongoing activities in the country. Dr. Leela, if you can hear us, it is now over to you.
Midwifery. And also, I think your concern is most probably about what is happening now in your areas. And I think we're giving you a sort of national perspective, and I hope that many of you will have questions which are more concerned with what happens locally in your areas. So I just want to go through some of the work that the White Ribbon Alliance is doing, and I hope that you will consider us as your representatives. Please go back to the first slide. I'd like you to consider us, White Ribbon Alliance, as your representatives to take issues of midwifery policy, any delays or any lack of specificity for midwifery for your area. Our email ID is right at the bottom of the slide, White Ribbon Alliance, India.org. So it's WRA@whiteribbonallianceindia.org. So please, I beg your forgiveness that this is not so specific to each of your areas, but more at the national level. I think your next maybe webinars will be more specific to what exactly is happening in your area. Last year, we began the year of the nurse midwife with great splash. And this slide actually is there to show you how everybody is standing together at one table. The people standing over here are representatives of the government of India. This is Dr. Rati Balachandran. The next one is Mitali Adhikari. She's the president of the Society of Midwives India. The third one is the director of Lady Hardinge Medical College and the Medical College Institutions of Delhi, representing academia as well as the medical fraternity being present with us. Ma'am Preeti Sudan, Secretary, Health and Family Welfare. Dr. Henk Bekkedum, representative of the WHO in India. Dr. Shumita Ghosh, at that time was the Deputy Commissioner of Maternal Health, who also represented the Maternal Health Division at this. And the last one is Ma'am Bandana Bhattacharya, one of the founders of the work on midwifery in India and a pioneer in her own right for midwifery education, not only in India, but in our region. So this gives you a sense that everyone is together at this time to try and promote midwifery. It's our job to ensure that this vision gets put into action. It's been a year since the vision is still not really put into action. We're still training trainers. We have not got to the stage of training midwives. Next slide, please. So with the support of the Bill and Melinda Gates Foundation, White Ribbon Alliance India has joined the midwifery initiative of the government, and this is exactly what our role is. White Ribbon Alliance stands for working for mothers, healthy mothers and their newborns. That has always been our goal, and for the past 20 years, we've been working in this area. White Ribbon Alliance is working to build recognition of midwives, to build healthy partnerships between midwives and mothers. And finally, to enable all health professionals and all team members to recognize the work of professional midwives, to ensuring healthy working relationships and practice of midwives wherever they may be. Next, please. What do we do? I was asked to speak about communicating about midwifery. White Ribbon Alliance and many of us, we are very concerned that we talk from a perspective of evidence. And the global evidence, which doesn't only come from developed countries, but comes from across the world, where midwifery is now very much working at scale at professional levels. This data is gathered from all over. So the first one is the presence of a skilled midwife at birth is the single most important factor to achieve safe motherhood. Since midwifery-led continuum of care improves quality of care, increases efficient use of resources, decongests high-level facilities, and reduces over-medicalization during childbirth, and reduces preventable maternal and newborn mortality. We also know that around 87% of all sexual reproductive maternal newborn health care can be provided by midwives when they are educated to international standards, making training and skilled midwives a critical asset to the public health system. And it can also help lower almost 83% of all preventable maternal deaths, stillbirths, and newborn deaths. There's also systematic evidence which is showing that the continuity of care, which the midwifery model of care provides, can reduce preterm birth by 24%. Put together, these kinds of evidence show that there is a 16-fold return on investment in terms of lives saved and costs of cesarean sections and other surgeries avoided. Professional midwives can bring a philosophy of care that brings consistent wins to reproductive, maternal, and newborn health, putting India within close reach of universal health coverage and the SDGs. The midwifery model of care promotes at its core something called physiological labor and birth. This means expectantly waiting for the human physiology to take over and help in birthing. It reduces intervention and medicalization and leads to the lowering, especially of elective cesarean sections. When women are less anxious, they need less painkillers, the oxytocin works much better, the cervix dilates without any additional needs, and the birth process and the early attachment of the mother and baby, the bonding is so much better. So at a population level, the cesarean section rates should not be higher than 10%, with no associated reductions in maternal and newborn mortality rates. However, in India, and especially in urban India, in large hospitals, our cesarean section rates have been skyrocketing. Next slide, please. So within the Midwifery Initiative, what is the role of the White Ribbon Alliance and what do we work towards? We have come up with the 4 Ps. People, professionals, that means other professions, profession, that means the midwives themselves, and policy. We work at all 4 levels. So one of the first things that we're trying to do to establish an environment where nurse practitioner in midwifery, short form NPMs, and midwifery is promoted and is able to flourish, to ensure that the training institutions are institutionalized and that the current maternal and child health teams of care providers can welcome NPMs to shoulder much of the inpatient maternity care work. They should develop clearly understood and supportive working relationships and build clear communication and teamwork and answer questions on accountability of midwives in the public health system. Because with responsibility must also come accountability. NPMs should be working in teams to run the midwife-led care units themselves with clear rules and regulations that allow them to practice. A well-crafted career progression pathway must be made so that the nurse practitioner's role is clear and there is common knowledge among many nurses of the favorable advancement of their career through advanced career practice as nurse midwives. Next, please. So thank you very much. I am very grateful to WHO India office and to the COVID-19 Sphere Academy for allowing White Ribbon to be present with you. Please again note our email ID and join us in this movement to promote midwifery. If you have specific questions around the initiative of midwifery around COVID, that will be a separate session. So thank you so much. Over to you back again, Ram.
Thank you so much, Dr. Leela, for sharing the insights over the work that has happened and how to take it, how you are planning to take it up in the country. Bill and Melinda Gates Foundation has been one of the ardent supporters for the launch and for establishing the midwifery program in the country. I would now request Medha to share some of her insights about how the foundation is going to be one of the pillars for providing an ongoing support for operationalizing midwifery as one of the key pillars for the health system strengthening in the country.
Thank you, Ram. I hope everyone can hear me.
Yes, you are clear. Yeah.
Super.
Yes, Medha.
Super. So, one is I'd like to congratulate everybody that, at this point in time, we're all taking this time to acknowledge the role that nurses and midwives play in providing quality of care. And it's very important at this time, especially now that we are all working towards addressing COVID-19. And we all know that the critical role that nurses and midwives are playing at the front lines in providing this care. In India, as Manju and Leela have already outlined, that India's had a very rich with nursing and midwifery for the longest time. So it's really not a new cadre. What is new and what is a concerted effort is to understand and acknowledge midwifery-led care. And as Dr. Baswal very rightly pointed out, that it's a concept of collaborative care. It's not just one person providing care, but how do we make that experience of care worthwhile for women and their families? So I just wanted to ask you all a question. I can see quite a lot of you tuned in and very active on the chat. So just wanted to ask you a question. When do you think was modern nursing introduced in India? Any idea when that started? So as you think of answering that, I'll come to that later. But so we've had enough and more experiences. And if we go to the history of nursing, yeah. So that question I'm still not answering. But the first course in nursing started way back in 1867 in Delhi. And the first school of nursing for midwives with 4 students started in 1871. So our history is very long and very rich. And over the years, we've seen that nurses have continued to play a very critical role in providing care. And it's not just MNCH care, but overall care. And if we look at the current health workforce, nurses and midwives, but 89% of nurses and midwives in India are women. So we have to understand that women have a critical role to play at the front line. So we need to understand that we need to make sure that we have very clearly defined career pathways so that we have opportunities for them to not only provide services, but also have their own career progression so that they're able to be their own advocates, as Manju spoke about. And talking about our commitment to this issue is that we're working very closely in collaboration with the Ministry of Health and Family Welfare to not only strengthen the training programs that are being started for the nurse practitioner in midwifery, so the programmatic rollout of that intervention, but also to look at the whole environment building that Leela just talked about. How do you make sure that within the health system and amongst users of services, there is a respectful environment wherein women are able to receive quality and personalized care. And in all of that, midwives are acknowledged for their role and support for the health system. So that's the whole ideology that we're working with and towards. And I think the current framework, I saw a lot of people wanted the context today to be linked to COVID. And I think we've had enough and more demonstration of the fact that your primary care is being provided by your frontline workers, your ASHAs, your ANMs, has shown that women in healthcare have a very critical role to play. We recently had another webinar where we heard from this midwife who's working at a PHC, continuing to provide quality MNCH care services, delivery care, newborn care services, amidst this whole COVID scenario. So there's so many of them out there, and I think it's really important for all of us to make sure that we're supporting them and we're being very respectful to the kind of services that they're providing. And just being mindful of time, I think I'm going to stop here, and because I'm really keen to hear from Indy about the actual services that they're providing and the training that they're providing to midwives for the times to come. Priya, Ram, over to you.
Thank you so much, Medha. That was wonderful. Thank you for sharing your insights on how women are a key part of this whole initiative. You talked about 89%. Wow, that's a lot. We are doing a lot, I guess. Let me ask Ram now to invite our next speaker, please.
Yeah, thank you, Priya, and thank you, Medha, for your insights on this topic. I would say that, the current COVID pandemic has thrown very unique challenges to the health systems. On the one side, we were already struggling to provide quality care to all our pregnant mothers while ensuring a respectful and, safe environment for them to deliver in the hospitals. COVID has complicated the whole thing, and it has put in a new sense of, the spanner to say that these are the certain new challenges that our health systems have now to work around. It is indeed, it is a very innovative approach that the hospitals are now utilizing to address both the issues of providing respectful care, ensuring birth companionship, while also preparing themselves and the mothers in view of the COVID pandemic. So, Indy, for you, we have a very difficult question to ask, that how the midwifery is going to adapt itself in the current scenario where the COVID has become, something which is at the back of everyone who is coming in the hospitals, and how are we going to ensure that the health systems and our hospitals are able to retain the trust of the pregnant mothers and the families within the system itself, and more so with the midwifery services. Over to you now.
Thank you, everybody, and good evening. Now, I was asked to talk about the training that's happening in the nurse midwifery educators, but I'll bring in your questions as I speak. So I think you have my slides.
Praveen, can you help with that, please? Yeah.
So a couple of questions. So good evening, everybody. I've been in India for 3 years and helping in embedding midwifery training, but 1 year went to another, and then exciting things happened throughout the journey, and now I'm here helping Fernandes Foundation and in the National Midwifery Educators Training. If we go to the next slide, we know why India needs midwives. All of you have said it. Dr. Manju has said it, Dr. Leela has said it, Dr. Baswal has said it. In every research and White Ribbon Alliance as well. But the most important thing that it seems to be not said much as well is a mother never forgets her birth experience. And why should our Indian mothers not have a positive birth experience? Respectful care is from the start. The training that we do introduces the midwives to actually introduce themselves to mothers and how they actually train in and talk to mothers. That's the most important thing. A lot of times we don't introduce ourselves to mothers. we label them, that woman with diabetes, that woman with whichever complication she has. So until we look at midwifery and the training of midwifery as not a medical complex problem. Leela has said, yes, birth is a normal physiological process, but does our curriculum help our midwives and our midwives educated to look at birth as a normal physiological process? So this is how we need to first make the change, to take it away from the medical model, but still collaborate. But in order to do that, how do we do that? Midwives need to be respected. Nurses need to be respected. And until the respectful relations happen between healthcare professionals, it will then translate back to women and the patients that they care for. So that's a really important subject. And if you look at that, the public hospitals, that's where midwives need to play a part. And once we've got more midwives, then they need to go and work everywhere else, and even in the private hospitals. Okay, so can we go to the next slide, please? So I will not discuss that, but we know that the first National Midwifery Educators Training, and it's amazing that we have reached this stage, happened in November 6th. We'll go to the next slide, please, because I will then expand on how this training is different. Now, this is just the glimpses of the inaugurations. We have a WHO representation, Ms. Payden, who's a deputy representative to India, Mr. Dilip Kumar, Dr. Baswal, and Andrew Fleming, who's our Deputy British High Commissioner, who's very supportive of the work that we do here in India. If we go on to the next slide. So now how is our training different? We use a lot of simulation need learning for the midwives educators. The training needs to be changed from a didactic model, just classroom based, where it's spoken on the theory. What India needs is clinical, credible midwives. And in order for midwifery educators to teach midwifery, they need to be clinically credible themselves. And in order to do that, they need to see birth again as a normal physiological process. We know that simulation-based training provides them an environment, and it helps them build up their confidence, and it closes the theory-practice gap. And it increases the midwives educators, their theoretical knowledge and practical skills. And the women-centered respectful care, if you go on to the next slide, a lot of us in our training, we had to learn. In our previous training in Telangana, we had to teach them how to show empathy, how to talk to mothers, how to be kind, how to be compassionate. So it's, and how do you introduce alternative birth therapies, different birth positions, and listen to mothers, look at birth as an individualized process. It's not one size that fits all. Every mother is different. Every mother has her own birth preference and her choice. And you can still do that in public hospitals, because we have demonstrated that that is done. One of the successes of Telangana was in the last 6 months, no women birth on her back in lithotomy. They all birth in different birth positions. So this is the change that we have to see. And despite COVID, it doesn't mean that mothers need to have a cesarean section. There is no indication, unless if it's a medical indication, that they have a cesarean section. So we should still be providing them with a humanized care. Beneath our mask, we should still be looking at mothers, and they're frightened, they're fearful. They haven't seen the healthcare professionals. You can either do telecommunications or bring them in at the specific antenatal period so that you can actually keep an eye on them. Talk to mothers. You can talk, every mother has a phone. Ask her, how's the fetal pattern? Is she worried about anything? So we need to put ourselves out for the women in our country and in India. The training as well looked at reflective models. And in order to have reflections, you need to have case-based learning. Each and every trainee all across the states have got a wealth of experience. You have the talent in India, and each of them brings back their cases, and they speak about how they dealt with the case. What would they do the next time? So it's a reflection structured model, and that helps with the training and helps each other, because each state, they need to come together. And how are they going to set midwife-led units up? First, they need to understand what is midwifery-led care. And collaboration is really important, because the midwife will be trained to be an expert in normality. But we know that some mothers may develop medical complications, and this is when the escalation needs to be done timely. But however, a midwife also then needs to be trained with the obstetric emergencies if that happens. And in order to do that, she needs to have the confidence, and you need to train together. Midwives and doctors need to train together. There is no hierarchy in medical obstetric emergencies. The first person that comes deals with the situation. So in the training in Telangana, we have multidisciplinary obstetrics and midwifery training. And that's when they train together and they learn each other's roles and responsibilities. If a doctor doesn't know what's the role of a midwife, and if the midwife doesn't know what her role is, this needs to be done in teams and collaborations, and how the communication is structured. During an emergency, there's always a pandemic. Everybody is actually shouting. Nobody is actually knowing who is doing what. So a structured approach on how we deal with situations. If you can go to the next slide, please. So midwives also have been trained to deal with shoulder dystocia, neonatal resuscitation, postpartum hemorrhages, and preeclampsia. Now, postpartum hemorrhages and preeclampsia, as Dr. Baswal has said, in India, maternal mortality is high, and it's coming down, but it's still at the level that we should have it further reduced, because these deaths are preventable. And if you have somebody that's been trained on a global level, you will reduce that. Countries like India, Sri Lanka, and Malaysia have reduced their mortality rates. So that is really important. But the thing to remember in this training, it's a lifelong training. They're not going to be trained on a one-off. They need to have continuous professional development. They need to show how they are improving, because evidence changes. We all know that you don't need to do routine episiotomies for first-time mothers, but that is still being done in some places. So you need to be up to date with your evidence-based practices. And I feel that this is the time. Now you're doing midwifery educators training. They need continuous professional development. They need to have a portfolio to say what evidence they have read and how are they going to reflect and change their practices. Next slide, please. So we've had perineal suturing workshops done by one of our consultants. If we go on to the next slide, because we found that even the definitions of perineal tears have not been quite clear, and some midwives were confused. And we had a Safe Delivery app workshop organized by Maternity Foundation, and all 30 midwifery educators training were certified as Safe Delivery champions. It's important that they train following the government of India's recommendations as well. Again, if you go on to the next slide. Can we have the next slide, please? And I must say the support given from the WHO, and that's Dr. Pushpa coming to speak to us and coming to speak to each and every trainee, finding out what were their challenges, how can we support them through the training. So the midwives trainings have been with us for 4 months, and due to the pandemic, they have now gone home to their individual states, but we've kept them busy. If you go on to the next slide. And we've kept them busy with research. We've kept them busy with doing some midwife-led units structures, and how are they going to plan to open it up. But until they understand what midwifery is and know the true philosophy, India will change. And we've kept them busy. So I'm open to any questions now, because I'm conscious of the time. Thank you.
Thank you so much, Indy. That was a very, very good presentation. I must say, you've taught us that, it's moving from patient care to maternal mothers and
Yes.
caring for mothers, really. And that's what midwifery is all about. I'd
Absolutely.
like to, absolutely,
It's
ma'am.
births.
Yeah, it's about the mothers. And we are just coming in from celebrating the International Midwife Mother's Day yesterday, where we
Yes.
did have a midwife
Yes.
present on the services that they were doing. It was heartwarming to know that.
Yes.
So thank you so much for your presentation. I'd like to now ask Ram to invite our last but not the least and most favored speaker. I would say she's been moderating sessions in the past. So it's good to be on the other side, I hope, Pragati.
Yeah, over to you, Pragati, now.
Yes, thank you, Ram and Priya. I'm going to share my screen and just begin the presentation.
Pragati tries to share her screen. I just want to share with everybody's benefit that, you know, Pragati is our very own midwife and consultant from WHO. But she's been representing the initiative not only at the national level, but at the global level as well. And a key resource person for pulling this whole week of celebration to showcase the work that midwives and nurses are doing, even in this pandemic.
Thank you, Priya, for your kind words. And yeah, it really feels good to be on the other side today, speaking as a resource person and not moderating like I always do. And I would like to speak about what WHO India is doing and how WHO India is supporting Ministry of Health and Family Welfare to take the midwifery initiative forward. So globally, when in global forums, you know, when everybody talks about India, India is very well known for how it led the midwifery initiative. And people do talk about the exceptional leadership of the government of India and how in a span of 2 years, we formed the policy, and then we had partners come in and chip in their bits and start the program. And now we are actually having capacity building programs in different corners of the country. So it was a huge achievement, and that's always being spoken about India in global platforms. So every country has a different system of midwifery. And in India, because we are taking in-service people, it's not a direct entry program. So we have nurses and midwives, nurse midwives who are called registered nurse, registered midwives, who have already done their BSc nursing or GNM or MSc nursing, coming in for the training of NPM educators or NPMs, nurse practitioners and midwifery educators, or nurse practitioner in midwifery to do the training. So we have a different curriculum for them in India. Some countries follow a 3.5-year course. Some countries have like a, plug-in program for 6 months. Some countries have 2 years. So it's pretty different. And even in the region, India follows a different curriculum. So last year we had a curriculum designed for 18 months for nurse practitioner in midwifery, whom we call professional midwives, and a 6-month training program plus 12 months mentorship program for nurse practitioner and midwifery educator. So the NPM educator are the ones who are going to train the NPMs who are going to serve in the periphery, because this can get a bit confusing at times. So I'm just going to explain it for the benefit of participants in the session today. So World Health Organization has been supporting Government of India since many years to build the policy, to have the guidelines launched and everything, and so are other partners. So WHO specifically last year got the International Confederation of Midwives to give in their inputs in the curriculum and have a 18-month curriculum designed for NPM and NPM educators. And Indian Nursing Council, who are the regulators for this course, is finalizing the curriculum as we speak for NPMs, nurse practitioners in midwifery. And they have already finalized the curriculum, which we are using today at Fernandez, which is our first midwifery training institute for NPM educators. So WHO is also supporting development of an education toolkit, which is basically meant for the public health institutions where midwifery-led care unit will be set up. And this is not a whole package, but it will be part of the bigger learning resource package that is being developed and led by JPIGO as of now, with, of course, support from all other partners. So there were many questions in the chat box about what should be the qualification to become a midwife or a midwifery educator in India with this new policy being implemented and operationalized now. So for nurse practitioner and midwifery educator, who are basically the tutors for professional midwives, you need to have MSc, preferably in MSc obstetrics, and if not, MSc in any field with 5 years of experience. And if you do not have an MSc, then a BSc nursing degree with 7 years clinical experience. So that is for NPM educators. And for NPMs, it is BSc preferably with 5 years of clinical experience, and if not, GNM with 7 years clinical experience. So that is what the government of India has that's the criteria established to get into the course. So government of India last year committed that the requirement, at least in India, is to have 86,000 midwives. And whenever we talk about midwifery in India, in global platforms, we also talk about how huge a requirement is. And this commitment is a big commitment, especially now during the COVID times, because we know there's shortage of health workers. We know there is shortage of nurses and midwives working at the front line. So this is sort of highlighting the need for midwives in India, but also saying that we need more and more frontline workers when we have emergencies like this, like the COVID crisis right now. So to fulfill that, the first step was to have a first batch of midwifery nurse practitioner and midwifery educators. These are our first 30 who are being trained in Telangana, and India has already shown this picture as well. And this is being supported by WHO to Fernandes Foundation. Fernandes Foundation is one of the first national training institutes in India. We'll have another 6 coming up eventually, but that's the first one. And so we have started it this way. We do have a long way to go. And we hope we have support from all corners of India to take this forward, because we haven't started out yet with service delivery. We are still in the capacity building phase, and service delivery is actually the most important component of midwifery. And we hope that this initiative is implemented in a way that it sustains and thrives for a long time to come, and it stays in India forever and changes the way midwives take care of mothers. And maybe we also start thinking away from saying that, to give birth is having delivery, and saying that it's actually birthing, because you're not doing a favor to the women. Women is birthing herself. You're only assisting. Thank you so much. And over to you, moderators Priya and Ram. Thanks.
Thank you, Pragati. Dr. Ram, would you like to add anything before we conclude this session?
Thank you, Priya. Thank you, Pragati, for sharing some of the essential criteria that we have in place now for the midwifery educators and nurse practitioners of midwifery in the country. We have come a long way in terms of establishing the midwifery cadre in the country, but we still have a long way to go in terms of how the states are able to implement the program. We have to ensure that the program translates actually from a program perspective into the more of a service perspective, where the midwives are able to provide the care to the mothers, as we have heard our esteemed speakers talk during the session today. So over to you, Dr. Priya, now for the next part of the webinar today. I just have one small update. Dr. Baswal had to leave for some urgent discussions in the ministry, so he will not be able to attend the second part of the webinar today. Maybe we can find a workaround, if there are any specific questions directed to him, we can take a note of it, pass it on to him in the office, and then find a way to circulate the answers to the respective participants. Over to you now.
Thank you, Dr. Ram. And I just want to take this moment before concluding this session with a short video that we have for you from WHO. I just want to take this moment to thank all of our speakers, Dr. Manju for sharing 20 years of experience, persistence, consistency, and really showing that midwifery matters. all the way to Leela, who talked about effective communication, the role of an enabling environment and what that means for realizing the dream that everybody has committed to. And often it's all about simply communicating in a way that people can understand. Something as simple as moving away from patients to mothers. Medha, as always, has been a key pillar of support in this entire initiative, leading from the front, always being on the back, but always being a helping hand and always supporting this initiative. Thank you, Indy, for staying back, starting with 1 year and going on to 3 and maybe many more. We look forward to learning from you, learning with you as evidence changes. Hopefully you are there to support and help the midwifery educators as you are doing right now. Finally, thank you so much to Pragati for taking the time to really showing how we are supporting as WHO, but also as coordinating agency, bringing people together. And that's what the session today is about. I'd like to now conclude the session and request Sphere India to share a small video before we move into the question and answer round. Praveen?
Yeah, Priya sharing the video now.
Great.
Is it
I don't know if it's for everybody, but for me it's frozen and I can see Dr. Leela's slide and not the video playing. So can you please troubleshoot?
is it the same for everyone?
I think it's the same issue for everybody. So if you could do it from where it's supposed to start.
Or maybe, Praveen, it's okay. I think in the interest of time, what we can do is share the video in the YouTube version, as well as a thank you note to the participants. You can send it to them. It's a WHO video on midwifery and the importance of midwifery in achieving the universal health care. Also appreciating the role of midwives in maintaining essential health services during this COVID pandemic. So now I'll hand it over to Sphere team to lead question and answers. I think that 2 of our participants had to leave in the interest of time. So in case there are specific questions to them, like Dr. Ram said, we can answer them later. But if you have any questions for Pragati, Indy, Dr. Manju, Dr. Leela, please feel free to ask.
Thank you, Dr. Priya. Thank you all the speakers and the moderators for a wonderful session. My apologies for the problem with the video. I believe I'm audible to all of you.
Being a little bit louder would be great.
Okay, sure.
Thank you.
I have also pasted the video YouTube link in the chat box for your reference. Then let's move forward to the question answer session. Since we are out of time, we can take 2 or 3 questions, and I would request you to address to the panelist whom you want to ask the question. And we have 3 raised hands. And Matthew, I'm going to unmute you now. You may ask your question. Mr. Matthew? Mr. Matthew, can you hear us? Okay, yeah, he seems to be out.
Can you go on to the next one, Praveen?
We have Mr. Surendra Kumar. Mr. Surendra Kumar, I'm going to unmute you. Please ask your question.
Hello.
Yes, Mr. Surendra, we can hear you.
Good evening, sir.
Good evening.
My question is nurse and midwifery. What is basic difference?
Indy, would you like to take that question?
There is a good evening. Thank you so much for your question. And there is a big difference. A midwife has been trained on global standards, and she does the specific training for 18 months and learns how to deal with women who are pregnant throughout the continuum. So preconceptual care, antenatal care, intrapartum care, and postnatal care. So she's been trained specifically to also provide antenatal support, empower women, giving them child education classes, and what to expect. And it's a big difference between the professions. So until the India does, which India has started doing, which we're very excited about, the separate program, it's a big difference. I hope
thanks, man. Thanks.
Thank you, Ms. Indy. And we have CH Padmini Roy for the next. Padmini Roy, I'm going to unmute you now. You may speak. Hello.
Hello.
Yeah, please ask your question.
Okay. Good evening to one and all. My question is to Manju ma'am. And before moving on to my question, I would like to say that it was really an interesting session, as well as it was very motivating for me, and I hope for the other people who have attended it also. So to ma'am, I just want to know that ma'am, it has been already predicted that in the upcoming days, India is going to have a more number of the birth rate is going to increase. So I just want to know from you, ma'am, that what are the challenges as a midwife can face in the upcoming days because of this pandemic right now we are going, and as such the situation is also will not subside in a couple of months or something like that. So what are the probable challenges we may face in the upcoming future, ma'am?
Manju ma'am, are you on call? Dr. Manju?
Shall I try to answer that?
Sure, ma'am. Sure, ma'am.
Hi, good evening.
Good evening,
I would say having midwifery is going to be not just a training for the professional midwives, but it's getting our consultant obstetricians to also know what the role of the midwife is. So, and because if you need to work collaboratively, they need to understand what is the midwife's sphere of responsibility and accountability and their limitations. Because midwives are, as I said, guardians of normality. But when there is a deviation from the norm, they need to escalate that appropriately and at the right time. So one of the challenges would be for our obstetricians also and our doctors to understand the differences and how midwifery shouldn't be medicalized. We need doctors, especially when mothers need help. But there's a large proportion of mothers that can birth by themselves if we leave them alone and don't introduce unnecessary interventions. We need to work on the evidence-based guidelines together so we can practice together and collaboratively.
Yes, thank you, Indy. I was not able to.
Sorry, no worries.
Yeah, thank you so much. And I think you have already answered. And in addition to that, I would say that we need to train them to deal with the number. Also, we are doing advocacy to have midwives in India because we don't have so many obstetricians and gynecologists who will cater to each one. And the goal is to have access to healthcare facilities for each mother. Each mother should have access to facility. And I think midwifery is the answer to that.
Thank you so much. I think we can take a couple of more questions.
Maybe one more question and then we can close it. I think it's already way past our time. So maybe we can have one more question.
Let's take our final question from Mr. Ritu Tomar. Ritu Tomar, I'm going to unmute you, please.
Thank you, sir. Can I speak in Hindi?
Oh, yes, sure.
थैंक यू मैम. एक्चुअली मैम आप सबने बहुत अच्छा बताया, काफी सारी जानकारी जो पहले नहीं थी अभी मिली. मेरा एक छोटा सा क्वेश्चन है, बाकी चीजें आपने बता दी हैं कि इस समय जो कोविड-19 चल रहा है इसमें मिडवाइफ का क्या रोल है, क्या उनको इस समय कोई ड्यूटी दी गई है या किस प्रकार की ड्यूटी दी गई है, अगर दी गई है तो?
हमारे देश में अभी ट्रेनिंग स्टार्ट हुआ है, जो ट्यूटर्स का ट्रेनिंग हो रही है, बट अदरवाइज आपको पता है नर्स मिडवाइफ्स हैं, जो रजिस्टर्ड नर्स भी है, रजिस्टर्ड मिडवाइफ भी है. तो अभी तक जैसा हमारा रूटीन में चल रहा है रोल एंड रिस्पॉन्सिबिलिटीज ऑफ नर्स और मिडवाइफ जो हमारे देश में है, वो लोग अपनी पूरी ड्यूटी उसी तरह कर रहे हैं जैसा एंटीनेटल क्लिनिक में काम करते हैं, वो डिलीवरी में असिस्ट करते हैं या डिलीवरी जिन जगहों में कर रहे हैं वो एज इट इज पूरा काम कर रहे हैं अपना.
मतलब रूटीन जनरल ड्यूटी है, कोई स्पेशल अलग से नहीं दी गई है, जैसे कोविड के अलग से ड्यूटी नहीं दी गई ना उनको?
उनको पीपीई पूरा पहन के करना है, पूरे वो फॉलो कर रहे हैं प्रोटोकॉल्स, वो सब पूरी तरह से करना है.
Thank you so much, Dr. Manju. Now, let me go to some regular administrative messages. As you can see, you can always reach us on SweerindiaCovid19Academy.org, which is our website. For today's resource materials and the previous session's resource materials as well, you can visit the website and go to the resource page, and you can download all the PPTs and other resource materials from there on. And for today's session, please visit the website after 24 hours for the certificate as well as the resource materials. And if you have any trouble or queries, please write to us at covid19academy@sweerindia.org.in. And tomorrow, a final day and the celebration of the nurses and midwives. We have the final session. We have a final session on challenges faced by nurses and midwives during COVID-19 and the way forward. Perspective from the government, regulators, and professional associations. As always, we start at 5:30 until 7 o'clock. Thank you once again, all the moderators and the speakers. Thank you so much, and looking forward to meeting you. Thank you.
Thank you, Sphere India, and thank you to all the speakers and moderators, everybody. Thank you so much for joining, and we'll look forward to seeing you tomorrow for our conclusion of the International Nurse and the Midwives week-long celebration by all UN partners in this time. So looking forward to hearing from more people tomorrow. Goodbye, good night.
Thank you, good night.
Thank you all the panelists for
Bye, everyone.
time today.
Thank
Bye-bye.
you. Bye. Good night.
Thank you all the participants for sparing the valuable time to attending the session today and hearing us